All right, we've been talking about your breast health tonight, partnered with the MedStar Health Cancer Network, and I'm joined now by Dr. Aboulafia. Thank you so much for joining us.
Thanks for having me.
Doctor, let's talk about breast cancer. You know, the myths. Everybody thinks that all breast cancer is the same. True or false?
Yeah, totally false. So people come from different experiences. They may have friends or a relative who had breast cancer, and they lump it as one big disease or one big condition. But breast cancer comes in many different shapes and forms, and treatments and prognosis can be very different depending on what kind of breast cancer you have.
And I'd imagine everybody's body is different too.
You bet. That's exactly true. And how people respond to different treatments are going to be different. As the science progresses and as we learn more and more about breast cancer, we've developed more effective therapies, better investigational studies, and really personalize the treatment for the individual breast cancer that someone has. So some people come into with the notion, I had a friend or a relative who had breast cancer, and this is what I can expect. It's not necessarily true, and it's important to sit down with your surgeon, your medical oncologist, and really understand what your options are for your particular breast cancer.
What about if you don't have a family history? Oh, I'm not at a risk for cancer. Now, this could be a scary one.
That's a big one because a lot of people, hear about familial breast cancers and the BRCA gene and Angelina Jolie, but it turns out that 70% of breast cancers, or the majority of breast cancer, there are no risk factors. The things you can do or you can control, you can't pick and choose your family, you can't pick and choose your genetics, but you can stop smoking, never start smoking, exercise, healthy lifestyle, and excess alcohol consumption is also another risk factor. So those are the risk factors that you can control. The genetics, that's kind of out of your hands.
Quickly, breast cancer is always painful.
Yeah, another one. People get real worried because they feel something and it's painful. The vast majority of breast cancers are not painful. So actually, pain might be a good sign. That's not to say you don't have to have it checked out. Some breast cancers can be painful, but the vast majority, not painful. Big myth.
All right, Dr. Aboulafia, thank you so much for coming in, providing us with some very valuable information.